we're going to see the lab findings. The lab findings of the hemostatic disorders. Hemostatic disorders. So we'll be dealing with about 5 to 10 disorders, and we'll be discussing its platelet count, its bleeding time, its PT as well as APTT, as well as we are going to see some important descriptions. So to begin with, first we'll be looking at the ITP. So what is the ITP? So under ITP, the platelet count. So first let's just write down what we are going to see. First we are going to see the platelet count, then comes the bleeding time, then the PT, then APTT, and we are going to see some important conditions. So first we are going to deal with the ITP. So in terms of ITP, the platelet count, you can say it is decreased. And what about the bleeding time? Bleeding time is increased. The PT, it remains normal. The APTT, it remains normal. Now other important notes is that the autoantibodies against the 2B and 2B3A or 3B. There is autoantibodies. There is autoantibodies, and this is against the 2B. Against 2B, there are 3A, 2B3A or the 1B9. Next we move on to the glandsman. So in terms of glandsman, the platelet count, it remains normal. The platelet count, it remains normal. The bleeding time, it is increased. The PT, it remains normal. And looking at the APTT, it again remains normal. So in glandsman, only the bleeding time is increased. Now looking at the ITP, we saw there is increase in the bleeding time as well. But the PC, that is the platelet count, it was decreasing, whereas in glandsman it is normal. Now what are the comments? So other notes we need to know is that the glandsman, it's a defect in the, so there is a defect, and this is in the 2B and 3A. So defect is in the 2B, 3A, and it is AR, that is autosomal recessive. Now we move on to the BS syndrome. So what is known by the BS syndrome? That is a Bernard-Solier syndrome. So we look at the Bernard-Solier syndrome. So in terms of the Bernard-Solier syndrome, the platelet count remains normal, the bleeding time is increased. So till now what we saw, everywhere the bleeding count was increasing. So next the PT, it remains normal, and looking at the APTT, it is again normal. So the conditions, it is very similar to that of the glandsman thrombocytopenia. But now looking at some conditions, other important notes is that there is a defect in the 1B. So here is the difference, 1B9. And other thing to note is that it is AR, it is autosomal recessive, and there are presence of the larger platelets. There are very large platelets. Next we move on to the von Willebrand's disease. What is the von Willebrand disease? So von Willebrand disease, the platelet count, it remains low, or in case it is normal. And what else? It is in case looking at the bleeding time, it is increased, and looking at the platelet count, it remains normal. And then what about the APTT? The APTT is increased. So here comes a change in von Willebrand disease. The bleeding time is increased, as we saw in other cases, and here the APTT is also increasing. So APTT is increased. So till now we saw it was normal, now it is increasing. And what is the important comments here? The important note is that there are 3 subtypes. We have already discussed it in another video. Then we move on. So we move on to next to the hemophilia A and B. So hemophilia A and B. So in terms of hemophilia A and B, the platelet count, it remains normal. So everything is almost normal. The platelet count is normal, the bleeding time is normal, the PT is normal, and the APTT, if you see, it is increased. So only the APTT is increased in case of HA and B, that is the hemophilia A and B. And what is the important comment is that there is a X-linked inheritance. So it is a X-linked inheritance. Next we look at the liver disease. So what happens in case of the liver disease? In case of liver disease, the platelet count, it decreases. So in liver disease, the platelet count decreases, the bleeding time is increased. Bleeding time is increased, the platelet count is also increased. And looking at the APTT, the APTT is increased. So let's recap the liver disease. There is only a decrease in the platelet count. Everything else is increased. Bleeding time, platelet time, as well as the APTT. Next, we move on to the vitamin K deficiency. So in terms of vitamin K deficiency, the platelet count, it remains normal. The bleeding time remains normal. Then the platelet time, PT, it remains, the prothrombin time, it remains increased. So it is increased, as well as when you look at the APTT, it is increased. So in vitamin K, what happens? There is an increase in the PT as well as the APTT. Next, we will move on to the DIC. So what is the DIC? So in terms of DIC, there is a decrease in the platelet count. So the platelet count, it decreases, and there is an increase in the bleeding time. There is increase in the platelet time, and there is increase in the APTT. So what are the other important notes in case of the DIC? So in case of DIC, there is an increase in the fibrin degraded products. So this increase in the fibrin degraded. So increase in the fibrin degraded products. So to recap the DIC, there was a decrease in the PC, that's the platelet count, and other factors, they are completely increasing. That is in case of the DIC. Then we move on to the aspirin. So what happens in case of the aspirin? So in terms of aspirin, the platelet count, it remains normal. The bleeding time, it is increased. The platelet time, it increases. And looking at the APTT, it remains normal. So there is only in aspirin, there is only increase in the bleeding time as well as the prothrombin time. Next, we move on to the warfarin. So in terms of the warfarin, there is a normal platelet count, the bleeding time is normal, as well as there is increase in the PT. So PT, it increases, and this is even in case of the low doses. So in case of low doses also, the prothrombin time, it increases, and then even the APTT is increasing, and this is even in case of the low doses. So this was about a summary of lab findings in case of the hemostatic disorders. So we saw various diseases like the Glanzmann thrombocythemia, then the BS syndrome, the von Willebrand's factor diseases, the vitamin K deficiency, aspirin, warfarin, and we also saw some components such as the platelet time, the platelet count, the bleeding time, PT, APTT, and some important notes. So to learn and grow daily like this, please do subscribe.